about all our children. The hardest thing about what has been happening with CEC for many, many, many years is time. We obviously don't have time. We need to take advantage of every minute that we have. And reviewing 17 as opposed to you reviewing and getting the main concerns are working on.
This was just money.
But she explained the suggestion is we can bring this up under future agenda items and you guys can decide then because we're taking a lot of time.
That's my
And we
concern.
have a lot of information we need to get to.
And we need to move on. I'm very concerned about our presentations for the rest of the year.
Summary is really important. You're absolutely right.
Yeah,
The
I'm not
information is
saying
very
I don't.
important, but I think we're getting it in the summary, and I think the next step has to be, let's take that summary and let's
Working our
actually,
plan. Let's do
let's make
Okay,
it
so
plan.
next time, don't give the full report, right?
No, CSC is fine. I'm okay with the CSC.
Okay.
Again, CSC specific. Again, as I think I said, you know, that is where I'm sitting here. And some of that,
But you're
some of that
representing
information.
other children in your district.
I understand, and I don't think I'm representing them any less by getting a summary as opposed to the exact detail. What is important though, and that is true, we as a group really probably need to make sure that we do follow up on those summaries with our respective districts and try and make sure that some of these, these issues are addressed.
Okay.
That I think we should really commit ourselves to.
And we've got two issues here, because what I'm hearing from Mo is that the concern is that the full complaint is being presented only on selected individuals.
CSC.
But Joan's explanation is that's not the case. What is being presented is when we have an issue within our group, the CAC, which we all represent, which we're all part of, if there's an issue, if we're doing something incorrect, yeah, shouldn't we be?
And the function of our group is special education, issues relating to special education, which means compliance complaints.
Yes, but these are
I've been dealing with these
But the
procedures.
CDE is already determined, CDE has actually a lot more authority than this as an advisory group. They actually order corrective actions. So their compliance monitoring is the more effective venue for a parent, because they order the district to go back and resolve the issue if there is a problem.
But we're not talking about taking their job. By all means, we can't do that. We don't have that authority.
And, but I think the purview of CAC is perhaps, the focus is perhaps a little bit different. You're not able to go back and order the district. You're welcome to come do any of the compliance complaints. They are public records. They are in my office. You can, read them all. I don't know that it's really that valuable to
Like I
go
said,
through.
I'm
But I could,
totally
if you'd like,
Let's move forward.
I can
I
provide just a
understand
summary of the CAC ones.
saying that, like I said, we need to do it in a way where it's not going to take so much time, but we won't have time to even cover our tonight.
Okay, I was just saying you don't pick and choose. You just, if you want to go full compliance complaint, then do it for everybody.
And we can all look in our own districts also, so and see where.
So if there's a CAC issue, then we can bring it up and address it then.
Yes.
Because I would have wanted to know, what did we do wrong?
Right, exactly. The procedure, CAC procedure. Yeah.
I'm going to go through the educationally related mental health services funding allocation. You have kind of a summary narrative. And so effective the beginning of this fiscal year, the responsibilities that the Department of Behavioral Health had to children in special education for mental health services came to the schools. With that, some of the money that used to go to Department of Behavioral Health was then allocated to the schools, and each SELPA got a portion of that based in part on past usage and in part on ADA. So there were two parts of money that were given out differently. There also, it was $98 million statewide in Prop 63 money, which is Mental Health Services Act money. that we can access through an MOU with Department of Behavioral Health. So that money comes to the SELPA. As a SELPA, the members of the SELPA determine how that money is going to be used, how it gets allocated out to each district. So the SELPA is bringing forth a proposal to the superintendents. And currently in our SELPA, we're rather unique in that we, for a long period of time, have been providing counseling services to students in special education. In part, the Department of Behavioral Health, their mandate was to serve severely emotionally disturbed students. That's the language they used. And so they had to meet a criteria that was higher than the students that we originally set up the SELPA counseling program for. Over the years, there has been a lot of history between Department of Behavioral Health and schools as to who has these responsibilities, how they're funded, and we really saw a shift because Department of Behavioral Health is primarily funded through Medi-Cal and really look at a medical necessity standard. Many of our students did not meet that standard and were not found eligible. The schools felt that perhaps 803632 had a little bit broader. It wasn't just meeting Medi-Cal necessity, but it was supposed to be addressing mental health needs that interfered with your school functioning. And so there's been some previous court cases. The legislature's been looking at this for a long time. At this time, what we're looking at is having the, there's two parts of what Department of Behavioral Health provided. One was called residential placement services, and that generally meant that students were placed at a 24-hour care residential facility where they lived there, and then there was an associated non-public school with that facility. The education is always paid for the school part. Department of Mental Health, in conjunction with Social Services, paid for the residential part, the living part, their room and board, and their mental health treatment related to that. So this is a completely new area for our schools. For the most part, most students going to residential treatment are our older students. This is a highly restrictive placement, and so, really for it to be appropriate, you usually have to have, you try to resolve the issue in less restrictive settings, and so inadvertently in our SELPA, because we have one high school district and two unified districts, it really, the burden of the residential costs adversely affects those three districts. However, because of the costliness of these placements, it also could have a very significant impact if one of our smaller elementary districts were to have just 2 students placed in residential. So if we divided the money up evenly and gave it to everybody, it could really, that wouldn't really be fair in a sense, or not so much fair, but equitable in the sense that, one district could really be wiped out, or, one district might have a large number of placements and would use up all of their money, and they wouldn't have any other monies left over to support their counseling program and other more levels of services. So the first concept that we wanted to get agreement upon was that the residential costs would be taken off the top of our allocation. So all districts would be made whole for their residential costs. And one of the formulas where it was based on usage did take that into consideration, and based on the number of students we had in residential last year, they weighted how much money we got for those students, and it was quite a bit more. So I think the last time we discussed this in September at superintendents, there appeared to be some good consensus on that. Any comments on that piece of that?
IU, how many residential kids do you have now?
I haven't checked recently, but I think we have 12. It's about there. Last year in December, we had 21, and this year we have 12. So that number can vary. Many of the students that go into residential placement either graduate from their residential placement or age out.
And
So
how many are within the high school?
I know there are 2 elementary,
And the
so
last
the other
one,
10 would be in the high school.
which was last year that I spoke about the residential, because it's a big concern because of the money. How many of these kids are actually regional center clients?
None.
None of them are regional center clients? Have you guys tried to seek regional center services for these kids if they meet the criteria, so they don't?
I mean,
burden?
if we have in the past had students that were duly funded, but at this time, I mean, most of these students are actually very bright, very capable students. Oftentimes when they get placed in an appropriate placement with support, some of them graduate before they're 18. So these are students that, have mental disorders related to their emotional well-being. Cognitively, as a group, they're very bright kids.
Where does the expense fall when, say, there's a foster child that's in a district? Does that district, the society, then accept that cost for the child to go into residential care?
Yes.
Is that part of the formula now that to base it on usage by the various systems?
What we felt was that we would have an adequate amount of money as we, kind of budgeted out so that we could we would have enough money to completely pay all of the residential costs. And then there is still money left over for kind of what the West End Clinical Counseling Program has used, and then there would be money distributed out to the districts.
But again, that would be based on usage,
The
by historical usage by the districts.
our funding was based that way, our IDEA money. It came in 2 pots of money, state money and federal money. The federal money was based on usage on a weighted formula. The state money was based on ADA. Now, we only have some very preliminary information on the governor's budget for next year. The suggestion was that next year all of the money was going to be based on ADA, but I don't have any of the details at this time.
Question. When you lease a facility, for how many years do you lease it, and do you expect the funding to be there depending on the lease contract?
We would, at this time, be looking at a year-to-year lease.
Because you don't know if next year they're going to fund it or not, right?
I would assume that they're going to fund it. I mean, I think that, although it's probably an underrepresented group, certainly a lot of the disabilities rights groups have been very active around this issue. And I think, it's been funded for years in this state. The funding just went to DBH. So, I mean, the funding continues in the governor's budget for next year. And, I mean, there's been a long history of funding for this program. The question really is, how much does it cost? I think that's what the legislatures. So basically, this is restricted
I
money.
have a question regarding the leasing.
Can we wait till we get to the leasing part?
Oh,
Okay, so we kind of just, I wanted to give the big piece. One piece is the residential part. And if you're more of a numbers person, you can look at the spreadsheet. If you're not a numbers person, it maybe isn't where you want to go. But, you see there our total mental health funding, and then it's broken out as to what each of the costs would be. So in the top, you see where it says residential, And that would be the dollar amount we're talking about.